Daniel R. is a 28-year-old Mexican-American man living in California with some roommates in an apartment. He is self-referred to therapy after a coworker encouraged him to get some help after noticing his low mood and low energy for the past few months. So he came here voluntarily and is motivated by a fear that his symptoms will get worse. The main presenting concerns are persistent fatigue that he's experiencing every day, emotional numbness and withdrawal from social and personal activities which he used to enjoy, and increased alcohol use in the past few months. His symptoms are affecting his daily functioning, including his ability to go to work and his ability to maintain interpersonal relationships. Key takeaway from intake is that Daniel's low mood, is described as a numbness. He wants to feel again. And he has noted a significant loss in his usual hobbies, a loss of interest in those hobbies, including cooking, working out, specifically playing soccer. He isolates in his room after work every day, and even has alcohol hidden in his room to numb all the feelings that he's feeling. Functionally, he's calling out of work every morning, or a lot of mornings, to combat his fatigued energy, low energy. He has trouble getting out of bed, and even at night, it's a hit or miss. It's inconsistent, his sleep schedule. He is either going to bed really early, and getting a full night's rest and still waking up fatigued, or he's going to bed at 3 or 4 in the morning, and struggling to get up in the morning or missing his alarm completely. He is also having a lot of trouble concentrating. He has to reread emails over and over again to get the gist of them, as well as forgetting simple everyday tasks, paying bills, etc. He experiences a lot of guilt, and we talked about his cultural upbringing and his cultural values. Like I said, he's Mexican American, and he's expressed that his culture prides themselves on being private and self-sufficient, so he has a hard time reaching out, and when he does ask for help, he feels immense guilt, and that it questions his ability and self-sufficiency, which is a strong value in his self-identity. So let's talk about his alcohol intake. He notes that he has always drank a lot for the past few years, and he's went from 2 drinks a night to 4 to 6 drinks a night on weekdays, and even more on the weekends, which is concerning. He hides his alcohol in his room, and he is extremely embarrassed on his alcohol intake, which shows the insight of his maladaptive behaviors. So some risk factors are the heavy alcohol use, and it's impairing his work, it's impairing his interpersonal connections, and his self-image. He has passive suicidal ideation, sometimes thinking that life would be better if he just never woke up or if he wasn't here anymore, but he has no plan or intent to harm himself or others. Like we noted, the sleep disturbance and the cultural pressure to keep emotions private and to himself. But he did note that he cannot do this alone, which brings us to protective factors that I've noticed. He is self-referred, so he wants to be in therapy. He wants to get back to normal. He wants to do better for himself and to improve his mental and physical health. He has stable employment. His job is stable. His social connections, he's distanced himself from them, but they are still available, as he's noted, and he wants to get back to his regular self, where he can go and have fun with his friends again. So my main diagnostic consideration is major depressive disorder, moderate to severe, and I just notice his low mood, his fatigue, his sleep issues, poor concentration, and suicidal ideation, and his withdrawal from usual activities. And then I'm heavily considering a severe alcohol use disorder diagnosis, given how much he's drink and how much it's increased in the past few months, comorbid with his MDD, of course. And then one thing I wasn't clear about was he mentioned a lot of anxious symptoms, but I am not sure if he meets the full criteria for a general anxiety disorder, or if these are just co-current with his depressive symptoms. Like, is he anxious because he's depressive? I need to assess that further. But he's cooperative, he's enthusiastic about bettering himself, and he wants to combat this low mood and this depressive state that he's in. So his strength is definitely his motivation. As for moving forward and some questions I have, I just want to know how to differentiate worry, like general worry or concern for oneself, from an actual anxiety disorder. I think sometimes as soon as a client says worry, I get a little bit jumbled and hop straight to an anxiety disorder. And then the next question I have is, how do I develop the next steps in his safety plan? Because I want to address his alcohol use, but I also want to address his suicidal ideation. He just seems really ashamed about both of them. And although he is eager to get help, there's still shadows of shame. So, do I directly address both self harming behaviors, or do we address the shame first? Thank you for your time.